Firstly, I'll talk about how Nottingham actually conduct their interviews. They're online, I think all of them are online now since COVID, and they're multiple mixed interviews, or MMI for short. The way MMIs work is that you will be given a carousel maybe of 6 different stations. It consists of role-play situations, which can be clinical or non-clinical. I'll talk about that in a second because I had quite a few in my interview. You can be asked about personal experiences relating to your work experience. Generally, they ask these to just see how you respond to situations which are adjacent to working in a clinical setting, because they understand you might not have had the clinical experience yet to answer some of these questions. So what I mean by that is, take the really standard question they ask of, give one situation and how you overcame it. Now, then they don't actually really care about how you overcame the situation. It's really just to test how you respond to being faced with challenges and if you can overcome them in a sensible manner, which would be appropriate for someone working in healthcare. Another piece of advice I'd give for this, it's online, but I would say dress appropriately. You don't have to. They give you a disclaimer at the start saying dress, however comfortably you want to, or something like that. But in terms of how you dress and preparing for the day, the advice I'd give is you're allowed to dress what you want. Also, in your interview, you won't only be interviewed by doctors, so this presents 2 sort of things you should be aware of. Firstly, be polite about all professions, speak about them in a respectful manner. If you're asked why not be a nurse than a doctor, or why not be a carer than a doctor, there'll be some overlaps. I'd say just be honest, make notes of the differences in these professions beforehand. I worked as a carer and I was asked something similar as a follow-up to one of my questions about being a carer. They're like, why don't you keep being a carer? And my answer was along the lines of, caring takes a much more personalized approach. Essentially, to be a carer, I wasn't taught masses of scientific information, which I then have the ability to apply to specific patients or clients. What I would do instead is have to just develop up a personal relationship with each specific client, which you sort of lose that every time you meet a new client, which I always said I wasn't really a fan of. I wanted a bit of continuity to my care, and while there are transferable skills between each client, that aspect of a doctor having a lot more transferable skills through the scientific knowledge they learn was a bit appealing. Okay, next I'll talk about work experience and your personal statement. So, as for your personal statement, the fact that you've been shortlisted to interview means your personal statement was good enough, so don't worry about that too much. And I think from this point, just really know it like the back of your hand. Make sure you can answer any question from it. If you're thinking of what questions you could draw from it, maybe I'd recommend copy and pasting it into ChatGPT, just saying, give me some questions on this, and going about it that way. As for your work experience, it's a lot more, I say there's a lot more to it, and especially when it comes to answering these sorts of questions. So first of all, if you're currently doing work experience, I think, as you start doing it, if you're not doing it already, really start, actively thinking about why you're making these decisions, just in case you get asked about something adjacent to that during your interview. And if your work experience is finished, you're not doing it anymore, start to think back onto why you made certain decisions, all of that stuff. There's no such thing as over preparation, so just give that as much thought as you can. I would say I was really quite confident, to be honest, answering my work experience questions, because I worked from maybe about halfway through year 12, all the way up until year 13, just before my exams. And I worked as a carer. I was doing actual paid work as a carer. So I felt really confident in making decisions. I had known throughout that time period that I wanted to do medicine, so I was always giving thought when, making certain decisions. What can an interviewer ask me about this sort of stuff? And even speaking to my co-workers who are more experienced than me, why they do certain things. I think that gave me a lot of insight. So speaking to people, if you're you're working in a social setting, speaking to people, asking why they do certain things is also really helpful. I'd say I learned a lot from my co-workers. Now for the third part of the video, I'll show you guys a bit around Nottingham Med School. I've been taking some videos the past week and week before. So first of all, I'll start with just the main entrance actually. It's attached to the local trauma centre or hospital in the area, Queen's Medical Centre. And the med school's part of that, and technically part of one of 3 campuses, which is the Jubilee campus it's a part of. If you've been searching up Nottingham online, you've probably seen more of the University Park campus, which is where like that white building which overlooks, that lake is. But we're not there. You don't spend any time there really, besides the first week. We're on the Jubilee campus, which is close by. Then so when you walk in, there's a cafe on the right to you. They're called Greenfield Cafe. There's seating to the left, and then in front of you is the main lecture theatre. That's called A1 Lecture Theatre. Do about half of your lectures there, I'd say, in first year. And then going across the corridor, sort of down a couple hallways, you'll find A3 and A4, which is the secondary and tertiary lecture theatres. So the type of stuff you'd expect to learn in medicine, like the biochemistry, learning about diseases, that's all done in the big lecture theatres. There's not much talking in there. The lecturer might ask a question or two, but that's where you do the bulk of your learning. Then the next classrooms I'm going to show, or just one of them because they all look the same, is A5, A6, A7 and A8. Now these are seminar rooms, so you do smaller group teaching, maybe about 15 people, with one lecturer at the front who might be a GP. I think my one's a GP, but not all of them are. And then essentially you just host smaller discussions there. Yeah, it's a nice opportunity to bounce off ideas with classmates, and you have that once every other week. Because in between that, you have clinical skills teaching, which is a different type of room which simulates a hospital suite. That's got hospital beds, it's got heart rate monitors, all of that sort of stuff. I also have a video of that, so I'll put that on screen. And then that's how you get your clinical exposure in. There's going to be some changes to that next year, which I'll speak in another segment of this video. But essentially it's just to modernise, how they teach clinical skills. And then lastly, in between lectures, most people go to Hips Cafe. It's a really nice cafe on site in the med school. Not limited to just med students. I think some of the workers at Queen's Medical Centre are there. Okay, going back to the interview stuff. So when it comes to timing, I kept running into the issue of I'm not speaking for long enough, basically. My answers were a bit too short. And how I combated this was I'd start using a format. I'd start using the STAR format, which stands for situation, task, action, and response. And the way I sort of built upon it a little bit was I'd try and use it twice. If I was asked how I dealt with a certain scenario, I'd use that format, and then I'd try and use it twice, with the first time resolving in the issue not being solved, and the second time I would talk about how I learned from failing at solving it the first time to actually solving it the second time. And I think that was just a nice way of me, extending my answer, showing a bit of learnability, and yeah, that was how I sort of extended my answers. If you're speaking for too long, that's a different issue. Your answers probably aren't concise enough because you have plenty of time to talk. You have 5 minutes. And any time you give an answer to a question, it doesn't have to be exhaustive of all of the ways you can think of answering it. Maybe just stick to 2 or 3 key main points and center your answer around those. Because if you do have a concise answer which is going above the time limit, I'd say you could probably get that down a little bit. And then who to practice speaking to, I'd say either get a transcript, this one's really weird, but get a transcript from ChatGPT, ask it how the format of your answer is, and it'll just give you some really vague feedback, but it just gets you in the habit of speaking out loud. And I wouldn't really fuss too much about the feedback ChatGPT gives, but just speaking out loud is is probably one of the things you're not very used to. If you're able to speak to teachers at school, that's great. Friends, that's great as well. And family is still great. It's mainly just about getting used to speaking about something which is, a bit more academic and boring to people around you, which I think is quite new when it comes to this interview stuff. The last thing I'd make sure I would do is prepare everything the night before. So if that means I need to email the school to say I'm not coming in that day, do that well in advance. Prepare what clothes I went to wear. And leave and join the interview smiling as well. Interviewers always try and act a bit stoic and not give you any indications of whether or not you're doing well in the interview or not. But I found that if you come across like you're not really all too nervous to be there, yeah, it can rub off on them a bit as well, and you can it can boost your confidence whilst you're doing the interview if they're giving you subtle indications that you're doing well. So try and do that, just join smiling, don't be too tense, make sure you have like good lighting, you're looking at the camera, all of just the little 1% things which can build up, because these are things which, even if you think the interview goes horribly, you should at least be able to be like, my audio was fine, my lighting was fine, I was looking at the camera, because these things don't take much interview skill. And don't buy into the myth that you can't improve on your interviews. You definitely can. It's not just a thing people have or don't have. And if you're invited to interview, the way Nottingham does it actually is everyone who's invited to interview is ranked completely separate from their UCAT, GCSEs, all of that stuff. So if that was something that was worrying you, you should stop letting that worry you now. Just focus on the interview. And as long as you, place in the top however many, 200 and something, you'll be given an offer. So anything to do with your UCAT A levels, if it stressed you out before, don't let it stress you out now. And yeah, that's all I've got written down, so thank you for watching.